Hello, this is Rafat. I'm working with CNI's Made in Nigeria project. This presentation is about teaching basic email and survey response skills to health professionals, specifically from our experience with midwifery students and instructors in Nigeria. To design and implement a digital skill training material for users with low digital literacy, we need to follow a step-by-step approach. This applies to any type of digital skill training that can be very basic, like Gmail training, or very advanced, like any programming language. At first, we need to have a deep understanding of the user's needs and context. After we gain full understanding of their needs, we design a user-centered material so that it becomes easily accessible and highly beneficial for them. In addition, we need to anticipate the challenges in advance before we implement the training in the field. Understanding the users, their context, their access and comfort level with technology is critical to developing any digital skill training. That's why in the beginning, we made a list of questions based on their background. In our project, the participants are Nigerian midwifery students and instructors with limited digital skills. They use mobile phone mostly to make phone calls. A few of them even don't own a mobile phone. The Mayday project team collected their email ID and WhatsApp number at the planning phase. The surprising fact is, although almost all of them have an email ID, but many of them even don't know the use of the email. Considering the participants' access and comfort level with digital technologies, CNI has developed the teaching material following a user-centered approach. User-centered design is an approach to digital solution development that is driven by the user's needs, capabilities, and context. The material is a pedagogically easy content developed around their skills, offered in local language, and presented by local facilitator. Concerns raised by the participants that most of them don't know how to use the Gmail application in their mobile phone. Thereby, contents mostly include the basic features of the Gmail platform. The training covers several features of the Gmail application, including how to download the app, how to sign into a Gmail account, checking inbox, replying to emails, how to compose a new email and send that to someone, and how to use different folders within the Gmail application. The training also had a component on how to participate in a Google survey using a link attached to an email. To make the training interactive, CNI's team sent them the Google survey link via email in advance, and they were asked to participate in the Google survey and send that response to us. To make a training successful, it is important to set a benchmark for skills development and track accordingly. To enhance their motivation to participate and confidence in using this skill, CNS also planned to offer them a training completion certificate. To ensure that everyone participates in the training actively and gets the intended benefit out of the training, the Mayday team set a benchmark of 100% participation in the training and at least 95% response rate in the practice Google survey. Throughout this process, the Mayday team faced several challenges, including support from midwifery school leaders was not satisfactory. That led to inadequate participation in the training. Therefore, the 1-hour training plan took 1 month to receive maximum participation. Other two substantial challenges were doing the in-person training during a pandemic and setting up wireless internet connection in a low-resource facility. We all know, due to this current pandemic situation, conducting an in-person training is not easy. CNIS has adopted several strategies to limit the chances of spreading infection in the classroom. The strategies include providing 3-ply masks, making sure alcohol-based hand sanitizer is available near the entrance and exit of the classroom, placement of desks or chairs maintain 3 feet physical distancing or 2-meter physical distancing guideline of CDC. The windows and the doors in the classrooms are kept open to increase ventilation, and using a social distancing calculator to plan and establish social distancing in the classroom. Now I'm going to hand over this presentation to one of the co-investigators of the Mayday project, Dr. Fanan Ujoh. He will explain how he set up the wireless connection in my midwifery schools in Nigeria, what are the key factors to remember, and what are the challenges anyone might face.